So on the news on BBC, I was reading that the UK government is expecting to increase the national insurance tax by 1.2%. This is to increase the funding for the NHS. Over the next 6 months, Boris Johnson and Sajid Javid have both said that they are going to give 5.4 billion UK pounds to the NHS. This is to increase funding for the NHS. With all the departments, government departments, I believe that the healthcare department is the most important department at the moment, especially with everything, with the coronavirus, everything, there's so much at stake, because the number of cases are slowly going down, and the UK needs to maintain the low number of corona cases, so people, and by giving regular tests, and by giving regular vaccines, the UK is doing that, and I believe that healthcare is the most important department in the government today, because everything happening with the coronavirus. It's been 2 years, and it should be coming to an end very soon. With the extra funding, the NHS would be able to test infections more quickly. It would help them with their day-to-day costs, and the NHS would be able to free up beds, because they would be able to discharge patients more quickly. I still remember that there was breaking news during peak lockdown that there were that during lockdown there wasn't enough beds in hospitals, and that was a major problem during lockdown, because a lot of people needed medical attention, and today a lot of people still need medical attention, and during lockdown there wasn't enough beds, but with the extra funding, the NHS can get enough beds for patients. To this day, I still think that the government needs to invest more in the NHS, because nurses, for example, they work so hard, they work so many hours, and they still don't get paid enough for what they're doing. And it's really a proud thing for the UK to have the NHS, because it's so effective. Because during the lockdown, you saw how useful the NHS was, how supportive the nurses were. They were going, how hardworking they were. They were going to work during lockdown, during the time when everyone needed to stay at home. They stayed, and they worked very hard. Some of them, I was reading that they had 15, 16-hour shifts, and they got home really late, and working over hours. And obviously we know how the situation with pay is with nurses in the UK. It's not very good at the moment. I believe with the extra funding, the UK needs to increase the pay for nurses, and this is why I believe the NHS needs to get more funding.